microphone?
Um,
Anybody else?
if you have one, that'd be
I
good.
could- Okay, I may go to the back and put some more together just in case.
Okay.
I have one left.
Um,
I did a number of chairs.
all right. So, I'll wait till Miss Dusty comes back. I'm gonna get a microphone, just in case we may have some more people that come in the back. I don't have to yell. I'm kind of soft-spoken, but I'm actually originally from, North Carolina, like the Raleigh area. That's where, little town south of there. My dad was military, so, I was born at Fort Bragg, North Carolina. If anybody knows about military life. My hat goes off to you military wise, because that is a whole nother thing in itself. To constantly move every 3 years or so and uprooting your family and all of that. But do we have any military veterans in here? Anybody, any veterans? No? Okay. Yeah, so I do have a special sweet spot for veterans. And because like I said, my dad was he was retired Army. He was 82nd Airborne. And a lot of family members that are retired military. So be loud enough. I feel special. I have this nice fancy mic. All right, so just a second. Oh, sure. We're just doing a little small talk. So did everybody have a good weekend?
Yes.
Good. Yeah, it's Columbia's getting busy. So I've been here, I get to talk about myself. I've been here in Columbia. My dad was stationed at Fort Jackson in the mid-80s, like 86. So I pretty much have grown up here over 30 years. So this has been home. But there's a lot of changes. When I graduated pharmacy school, I went to
Oh, I get some music too. Nice. Did y'all want to hear me sing?
She sings good.
Oh, goodness. Oh, that's the phone. Okay. All right.
What is that music? Oh,
That's the phone. Oh, okay.
Oh.
So I guess I will go ahead and introduce myself officially. So again, I'm Dr. Sabrina Russ. I'm a pharmacist. I've been a pharmacist for 26 years. And I've been board certified as a geriatric pharmacist. Does anyone know about like geriatric pharmacists? Like, what is a geriatric pharmacist?
Old people.
Old people. So this is a specialized training, additional training that a pharmacist can get. And we pretty much are specialized to work with, specific medication-related issues that we see a lot in our senior population. In a nutshell, that's what we do. Just like you have pharmacists who can be specialized in cardiology, or like you have doctors that are specialized in certain fields. Well, you can do the same thing as a pharmacist. You can be specialized in pediatrics and so on and so on. So I decided, I had a mentor. His name was Mr. Eldon Armstrong. I don't know if anyone has ever heard of him before, Eldon Armstrong. If you're from the Columbia area, you may know of him. He was one of the original owners of Hawthorne Pharmacy on Taylor Street. You all know about Hawthorne Pharmacy. So he was one of my mentors, and so way back, I guess, when I got out of pharmacy school, like I said, I went to University of South Carolina for pre-pharmacy, and then I went to pharmacy school at the Medical University of South Carolina in Charleston. But after I graduated, I decided I worked retail. At the time, there was a grocery store chain that I worked at, but I felt like I wanted to do more than just, nothing against my colleagues that are in the drugstores, but I felt like I have all this knowledge, information, but I'm just counting pills. I don't have the time to interact with patients like I want to. So I joined our state pharmacy association, and they connected me to my mentor. And so he encouraged me, you need to go on and specialize and become a board certified geriatric pharmacist. So I've been board certified for 18 years, and time passes. So over the years, I would say the past 10 years, 10, 15 years, I noticed a rise or a shift in people wanting to know more about like nutrition, health and wellness, things like that, more like preventative medicine. So about 2 years ago, I decided that I wanted to become a national board certified health and wellness coach. And so, you know, when you think about wellness, it's more than just let me take my medications safely so that I can stay out of the hospital. It is how can we, you know, prevent any type of, we don't want you to go into the hospital. We want to be more proactive. Talking a lot about nutrition, but also exercise. Like we have the group here that was in the exercise class, hydration, sleep hygiene, stress management, all of that is health and wellness. So that's another company that I started that's really more specific to health and wellness. So that brings me here today. So again, I'm so grateful for Miss Dusty inviting me to be here today with you all, because you know she, you know, interacting and being involved with the residents here. You know, I'm sure you see a lot, hear a lot, and things like that. And just out of concern and staff's concern, you know, they have me coming in just to teach you just how you can be more safe with your medications if you are on any. You may not be on any medication, which is great. So that's my focus here today is I started Simplicity Pharma Service and Wellness Center. That's actually my medication consultant company, and that's basically I work with patients, their families, caregivers, and their providers to make sure the patients' medications are safe and effective. We look for ways that we can safely remove any unnecessary or harmful medication, and the list goes on and on and on. So in a nutshell, that's kind of what I do, and I've started this company 21 years ago. So, and even in 21 years, it has evolved, because anytime you have business, you have to evolve with the time and with the demands of the consumer and the patients. So that's when I said, well, we just need to put all this together. You know, as a pharmacist, I want to work with you to simplify medications. I want to help you to promote your wellness and then empower families, because it's really, we have to all work together as a team to keep ourselves healthy like we need to be. Okay, in a nutshell, all this writing is basically what we're going to talk about today. And this is not going to be like you're just sitting in class. We definitely want you to learn, but I do like to be interactive. Shortly, we'll go through some of those handouts that we gave you earlier so that you'll know what we're going to be going through. Because I don't want to just sit here and just look at me like, okay, when are you going to be quiet? I'm ready to go. But in a nutshell, we are going to talk about just the importance of medication safety and how important it is to maintain your independence, right? You know, you want to be safe, because that's one of the things that providers look at and healthcare administrators look at, you know, to determine if you need to transition maybe to more specialized care if you're not able to manage your medications appropriately. So we're also going to look at medication lists. I gave you in your handouts there. It's the medication list. It's just a sample. You're free to, it's yours, you can keep it, but we're going to kind of walk through that today, but we're going to talk about that. We're going to, I'll help you identify some medication storage practices so we can prevent any errors. How do you properly store medication? We're going to talk about applying just real life strategies and how you can remember what to take, when to take, taking your medication and tools that are available. And then we're going to kind of share with you some tips how you can communicate effectively with healthcare providers, so you know how to ask the right questions. Because we know the healthcare providers, many of them are so busy that you might get 5 minutes, maybe 10 minutes. But a lot of providers, I work with one, a family practice office here in town, and the providers, they're just in and out, in and out, in and out with the patients. And so in that particular practice, they'll refer patients to me to sit down with them one-on-one and go through your medication questions and concerns. But a lot of offices don't have a pharmacist available. So you want to make sure you're prepared to go ahead and have questions ready and things like that. All righty. Okay, so why is medication safe? Why does medication safety matter? Why is it important? So statistics say that we have 4 out of 5 older adults take at least one prescription. At least one. And nowadays you have younger people, it's not just older adults. We have a lot of kids that are taking prescription medication. That's another topic for another day. Medication safety is important because sometimes some older adults begin to develop maybe multiple chronic diseases, so you're going to have lots and lots of medications that you may have to manage at one given time, and so that word is called polypharmacy. So that's being on really 5 or more medications at one time. And when that happens, there's always an increased risk for drug interactions, side effects, and things like that. So the ultimate goal is you want to have safe medication practices to prevent hospitalization side effects. Now, who wants to go to the hospital? Do you know anybody that said, I just want to go to the hospital today? I don't know anybody that George is going to the hospital. But unfortunately, because medication issues is such, very, just a high statistics in our country today, it is a serious burden on our healthcare system, and it's related to a lot of hospitalizations, emergency room visits are related to medications and medication safety or side effects or drug interactions. So, as I talk today, I just keep in mind that pharmacists, we are very more accessible, but we are underutilized. People don't use us enough. And, with me, I'm on a mission to try to educate as many people as I can to let you know your pharmacist would be your local pharmacy. They're there to help you, especially if it's an independent pharmacy, because they're structured a little bit different. They have a little bit more time to talk and interact with you versus some of the larger chains. But we're here to make sure that you are safe and to keep you out of the hospital. That's our goal. And so that you can age in place gracefully. Okay, so one of the ways that you can understand your medications is keep an updated medication list. Keep an updated medication list. This includes like your prescriptions, over-the-counter medicines, vitamins, and supplements. And you want to write down the dose, timing, purpose of each medication. So your handouts, you probably have in your hand, it's like a pink little ribbon across the top, but it's the medication safety, medication, trying to get mine. It's that one right there. Yep, that one. Let me grab, I thought I had one with me, but let me grab, everybody knows. Yeah, I'm gonna get yours. Thank you so much. Okay, everybody has this? All right, if you can pull this out, I would love it if we can participate. And we're not going to go through this whole thing, but I just want, you probably can kind of figure it out, but just in case someone might have questions, if you look at that sheet, and this is just a sample, but you can make copies of it and things like that. If you look at it, it has on there, of course, your name and the date. It has on there a space for allergies. Y'all see that at the top? Make sure you write down all of your allergies, even if it's food allergies, allergies to dyes. That's important. But on here it has the columns, the name of the medication. A lot of times when you get your prescription bottle, they may have like the generic name on there. And it should have, if there's a generic name, you might just know it by that name, but it should also have like the brand name on there somewhere on that label. It should say substitution for, like say for instance, if it's glucophage. Metformin is you might know the name metformin for diabetes or blood sugar. So in your bottle it may say metformin, but it should also have on there substitution for glucophage. So those words should be on your label so that you can be able to identify the brand name and the generic name. So on this sheet or a sheet like this, like I said, you can make your own. You're gonna, you can put both names on there, so that will help you to know. Then the next column says action. It says action. I'm taking this for, and you can put on there what you are taking that medicine for. So if you're taking it, let's say glucophage or metformin. You're taking metformin, you're taking it for diabetes or for blood sugar. The next column is your provider. You want to make sure you have your provider's name on there, whether it's a medical doctor, nurse practitioner, physician assistant, whomever your health provider is, make sure you have their name on there. Then it has on there, it's got morning, noon, evening, and bedtime. And that's just to break it down what time of the day, like say for instance, if it's metformin, you take it 1 tablet a day in the morning. So you can just put 1 tablet, like the number 1 or 1 tablet under that morning slot. So whatever time of day that you take that medicine, that's where you would put it under that column. Anybody have any questions on that? Okay. So that is how you would do that. All right, you guys are a quiet group. Moving right along. Okay, so I would like some team participation, some group participation in this. So this is what we call a case study. So these are like real life examples. Now this is not a real person per se. So in other words, if your neighbor or the person that you might stay next to you, and her name just happened to be Miss Johnson, this is not that person. Like the story is real, but this is not the real person. Does that make sense what I'm saying? Because I don't want anyone to say, oh, Miss Johnson's on 6 medication and she did not take her morning pill. No, this is not a real person. All right, so a case study, again, it is giving you an example. And you may be able to identify, so with these examples, every time we finish a section, we're going to have these case studies. So in this case, we have Miss Johnson. The title of this is called Forgotten Dose. So she forgot to take her medicine. This is the scenario. She's on 6 medications. She forgot her morning pill and wasn't sure if she should take it later or skip it. What would you do in this situation? Any volunteers?
I would skip it.
You would take it. Who said they would skip it? You would skip it. You would skip it. Okay. Any others? Okay.
It depends on what time frame.
Okay. Explain.
So if I just missed it maybe by 4 hours, I would probably take it, but it depends on how frequently I take that medication. If it's not for 12 hours, then I think between 4 and 6 hours I'm safe.
Mm-hmm.
But if I take it like 3 times a day, I would probably wait until the next time.
Mm-hmm. Okay. Okay. All right. Did everyone hear Miss Dusty in the back? Where she's basically saying that it depends on how many hours have passed since you was, like, say you're supposed to take it at 9, it's 12. It's 12 noon now, and you remember, oh, I forgot to take it. Then depending on, how many hours it has been, that would determine if she's going to take it. So none of these answers I would say is necessarily wrong, but what I will say is I would call your pharmacy if you can, and see, because it may be, and Ms. Dusty is pretty much right, because it depends on how many times a day you take it. Because if it's a medicine you take twice a day, like morning and night, breakfast and dinner, then you may be able to just go ahead and take it at dinner. Just take that dinner dose. If it's one that you just take 1 time a day, then it may be better if you just go ahead and take it, because you need to get that dose in. So that would be a really good question though for your pharmacist to ask them. All right, so how can keeping an updated medication list help? So if Miss Johnson if she had a sheet like this, her medication list, how could this have helped her to remember? A little bit louder?
She can look at the sheet
She can look at the sheet.
and monitor her medicine by the sheet.
By the sheet. Monitor her medicine by the sheet. It's a good way to be accountable, to kind of keep track of what you are taking, what you're supposed to take. Okay, very good. Any other answers, ideas? Very good. Yep, she can use the sheet. Now you can't, this is very, very basic, because Miss Johnson could have a system where when she takes the medicine, maybe put a check or something by the name of the medicine or that date or something like that. But there's technology in place to help in situations like that. But yeah, so ideally your medication list is there to help remind you. It's accountability so that you know what you're taking, why you're taking it. And another thing, you guys, is to have a copy for your family members or somebody that's close to you you can trust. Because if an emergency happens and you're passed out somewhere, Keep a copy with you at all times in your purse or your wallet, but somebody else needs to have a copy of it.
And,
Yes, ma'am.
and with smartphones like mine, I put it in my phone, so when I have to take my medicine,
Mhm.
it'll ring me a tune that
Yes.
says it's medicine.
So you have like an alert.
Yeah.
Did everyone hear what she said? She said, okay. Yeah, she uses her smartphone, which I think in a couple of slides I do talk about like technology, because there's apps, or you can take a picture of it, so it'll be there. But it's always good as well to have a paper copy too. And then when it gets updated, take it to your doctor. If they change, the medication, you want to update your list. Very good. Any comments, questions?
Doctor,
Yes, ma'am.
Russ?
Yes, ma'am.
I keep a list,
Okay.
but it would burn me crazy to go to that list every day. So then, the cases we buy in the drugstores, one is new.
The pill trays. Mm-hmm.
Trays, thank you.
Yes. I'm going to the next one. And here we are. We're going to start talking about it. Proper storage of medication. So you're exactly right. Having a pill organizer, I highly, highly, highly recommend that you have one of these, along with a medication sheet as well. Because even though you have this sheet to keep up with what you're taking, you still don't really know if it doesn't really remind you to take it, or if you missed a dose. You know what I'm saying? Like, you just have it on the sheet. But if you have a pill box or some type of reminder, like she used the smartphone and have an alert or an alarm goes off, then that can kind of remind you, oh, I need to take, my pill now. But when we're talking about medication storage, so not only is it good to have pill organizers, but also to keeping your medicines cool and dry, keeping it stored in a cool, dry place is very important. You want to avoid bathrooms. Now, I don't want to get a show of hands. I don't want anybody to be embarrassed, because I'm going to ask the question: Who keeps their medications in the bathroom? Oh, y'all do. Okay.
Because we have a lot.
Oh, you have a locked drawer. Okay, that's the exception. They have a locked drawer. But other than that, ideally, that's fine. But ideally, you don't want to, because it is like moist and things like that. So a lot of people, I tell them they can use their like dresser. Like some people do their kitchen cabinet, their store their medication bottles there.
Can I ask a question here?
Yes.
I hear folks say, do you have a medicine cabinet in your bathroom? Is that insulated so that there's no moisture to interfere with the medications?
And a lot of houses now, newer homes don't have that. But it does make sense. Like, it's called a medicine cabinet, but ideally, it doesn't. Yeah,